جام و جان با دکتر محمد نواب.
دکتر شیوا حدادیان پور متخصص بانوان رو در مورد مطلبشون بشنویم. این روزا همه به کووید توجه میکنیم بیشتر و فشار خون و غیره.
Hello, I'm Dr. Shiva Hadadian and I'm presenting a research on vaccine-induced thrombocytopenia with severe headache conducted by Dr. Farid Salih and Dr. Linda Shubar. It was published in the New England Journal of Medicine. Vaccine-induced immune thrombotic thrombocytopenia, or VITT, a serious adverse event after vaccination with AstraZeneca or Johnson & Johnson, is caused by platelet factor 4 dependent platelet activating antibodies. High-dose immunoglobulins and anticoagulations are the main treatment. In this report, we present evidence that vaccine-induced thrombocytopenia, VIT, without associated cerebral venous sinus thrombosis, CVST, or other thrombosis, and with severe headache as the heraldic symptom may precede VITT as pre-VITT syndrome. 11 patients presented with severe headache in the absence of CVST 5 to 18 days after AstraZeneca vaccination. All the patients had thrombocytopenia, high D-dimer levels, and high levels of anti-PF4 heparin IgG antibodies. During follow-up, intracranial hemorrhage occurred in 3 patients, patients 1, 2, and 3, with radiologic evidence of new CVST in patient 2 and 3. Only 2 patients, patients 2 and 4, were initially admitted with conditions that met the criteria for VITT. Both patients had pulmonary embolism and additional splanchnic vein thrombosis was present in patient 2. In patient 2, anticoagulation treatment had been initiated several days earlier for pulmonary embolism without diagnosis of VITT, but was stopped after the onset of headache shortly before CVST developed. In 2 patients, patients 1 and 3, peripheral thrombosis were eventually identified during follow-up. Thrombotic complications didn't develop in 7 of the patients, patients 5 through 11. But one of these patients received high-dose immunoglobulin, glucocorticoids, or therapeutic dose anticoagulation within 5 days after headache onset. In contrast, in all 4 patients with subsequent thrombosis, patients 1 through 4, therapeutic dose anticoagulation either wasn't started until 6 to 9 days after headache onset or was stopped prematurely before the development of CVST. Although the combination of thrombocytopenia and severe headache due to CVST has been recognized as the typical presentation of VITT, the experience with these 11 patients suggests that VIT with severe headache, elevated D-dimer levels, and strongly positive results on anti-PF4 heparin IgG enzyme-linked immunosorbent assay may precede VITT. The author's findings have immediate implications for clinical practice. In this pre-VITT syndrome, severe headache may not develop as a symptoms secondary to CVSD, but instead may precede CVSD by several days, potentially associated with microthrombosis in smaller cortical veins. Consequently, patients who present with severe headache 5 to 20 days after adenovirus vector vaccination against coronavirus disease 2019 should undergo immediate testing for thrombocytopenia and D-dimer levels, and if available, testing for anti-PF4 heparin IgG antibodies. When these antibodies are present at high titers, patients are at imminent risk for CVSD, and it is likely that this condition can be prevented with immediate treatment, such as with intravenous immunoglobulin. The decision to initiate therapeutic dose anticoagulation is a difficult one. The risk of emerging thrombosis, including CVSD, has to be balanced against the risk of intracranial hemorrhage on an individual basis, for example, with consideration of platelet count and fibrinogen levels. Thank you for your attention.
بسیار سپاسگزار از سرکار خانم دکتر شیوا حدادیان پور برای این گزارش جالب که از نیو انگلند جورنال مدیسین بود در رابطه با اینکه برخی از کسانی که واکسن علیه کووید 19 رو دریافت کردن به علت به هم ریختگی سیستم PFT4شون اینا سردردایی داشتن